Last year, when I was working, COVID-19 arrived at my facility in March 2020. I myself and thousands of nursing home workers around the country were denied proper PPE, staffing, and safety in the job. At my facility, when COVID-19 arrived, patients at the nursing home and administrator used N95 masks and full body suit. Yet at the same time, we even were denied simple surgical masks. One of the largest issues during the pandemic was that not just getting the PPE supplies at the nursing home, it was at the management that holding the supplies and refused to let staff have access to PPE. I got COVID-19 at the time and brought the virus home. Like the nursing home workers around the country, where I was ignored because we were women and predominantly Black and brown. OSHA also ignored us, even though we lost thousands. Even though we lost two coworkers in COVID-19, there was no one on the ground. OSHA ignored us to hold for profit employee accountable during the consideration, considering me and my coworkers were working it. The lack and the lack of accountability allowed thousands of nursing home workers just in my state of Connecticut to get sick. And we have 2,000 members in the long-term care who died from COVID-19 caused at work site. When our patients were getting sick and dying, when we were getting sick and dying, when our family members were getting sick and were dying, and our union representative contact OSHA and asked them to come and inspect the staff, the, the staff and safety from the infectious disease of COVID-19. What are you going to do to hold nursing home operators accountable to keep staff safe from this infectious disease like COVID-19?
I have picked tomatoes, oranges, watermelons in Florida, Georgia, Missouri. Since I joined the coalition, started to participate in 1999, we have campaigned for, won, and implemented the Fair Food Program, internationally recognized as the gold standard in social responsibility programs. The program, which received a presidential medal from the Obama-Biden administration, leverages the market power of large retail food corporations, food buyers like Whole Foods, Walmart, just to give a few examples, to enforce compliance with human rights code of conduct on participating farms. Farms who don't or won't comply lose the right to sell to the program's 14 participating buyers. Most of the CIW's code of conduct can be boiled down to one simple command: follow the laws in the book. The problem is, in US agriculture, violating farm workers' legal rights is the norm, not the exception. I want to tell you one story so that you understand what is at stake here and for everyone. Last summer, the CIW received a call from a worker at a farm that used to be in the Fair Food Program, but did not comply with the code and left the program because they didn't want to have to respect the workers and make sure they were safe. The caller wanted to file a complaint because workers were not being allowed to take breaks when they requested them due to heat. The CIW had to explain that because the farm was not in the Fair Food Program, the only resource in that instance was OSHA, and provided the OSHA phone number. 1 week later, the same farm worker called the CIW again, this time to report that one of his coworkers had died of heat stroke. The call was not answered. These stories are only going to become more and more common because workers feel more and more pressure to pick as much as they can. An emergency rule is needed immediately. Will you be able to work on trying to issue one?
Just a couple of things on the COVID front, and specifically for a nursing home setting. The new emergency temporary standard from OSHA is definitely helpful for the workplace that you've described, and we want to make certain that all of us at OSHA in any of the areas of the country are working with workers in healthcare to understand where problems still exist. If you have issues, if you have concerns, please reach out, contact OSHA. We are working on other education materials that will both be available in English and Spanish on heat issues. We want to make certain that we are working with workers and employers to understand where good practices have been in place so we can learn from that and try to utilize that. We also need to recognize and understand where problems exist and be responsive to those, again, through OSHA complaints or other means, to make certain that we are helping workers today and doing everything that we are able to do through outreach in a proactive sense, through response of complaints and enforcement when it's necessary, and also to build to the point that we can put together that the material that's necessary to work toward a rule for workplace heat stress issues.